Hi there, my name is Dr. Nicole Siegfried. I'm a licensed clinical psychologist. I hope you find this video helpful.
Should you only be looking for the strongest antidepressant for your severe depression? It's important to recognize when you need help, especially when it comes to your mental health. The first step in your mental health journey is recognizing when you have distressing emotions, thoughts, and behaviors that are interfering with your daily life. If you take a major depressive disorder quiz and work with a mental health provider to determine your diagnosis, then the next step is finding the best treatment option for you. A common treatment option for mental health disorders, such as depression, is medication to help manage the daily symptoms. When it comes to depression, there are a variety of antidepressants that your mental health provider may recommend. But strong antidepressants shouldn't be your only treatment option for severe depression. We'll read on together to learn about the basics of severe depression and antidepressants, as well as common antidepressant options that are available. We'll also discuss what other treatment options can be utilized in conjunction with, or even in place of, antidepressants to consider for severe depression. So what is severe depression? Depression or major depressive disorder is a mood disorder that causes persistent and overwhelming feelings of sadness, hopelessness, and malaise. It can interfere with your ability to carry out your daily responsibilities, as well as create and maintain healthy relationships with those around you. A mental health provider can determine the severity of your depression, often ranging from mild to severe. It's important to note that while severe depression is usually seen as a type of major depressive disorder, it is not a separate diagnosis. Depression can also become more severe as time goes on, or it can be affected by challenges and difficult situations, such as the loss of a loved one or losing a job. Severe depression symptoms are the most intense manifestations of major depressive disorder, including suicidality, loss of pleasure in activities, or feelings of worthlessness or guilt. So let's talk about the purpose of antidepressants. When you seek treatment for your depression, your mental health provider may suggest an antidepressant prescription. An antidepressant is a medication that is used to manage the symptoms of depression. It is also used as a treatment option for a variety of other mental health disorders, including obsessive compulsive disorder, generalized anxiety disorder, post-traumatic stress disorder, and panic disorder. For many people, antidepressants are an effective way to reduce depression symptoms, balance emotion, and boost overall quality of life. Here are the 5 most common antidepressants. If your mental health provider prescribes you an antidepressant medication, it is likely an SSRI, which is a selective serotonin reuptake inhibitor. These are the first choice medications by mental health providers for major depressive disorder. SSRIs help reduce the symptoms of severe depression by increasing the serotonin in the brain. Serotonin is a neurotransmitter that affects your mood and emotions, as well as digestion and appetite. It's sometimes referred to as the happy chemical because it's responsible for relaying feelings of contentment and optimism. The most common antidepressants are all SSRIs. The 5 most common antidepressants are citalopram, sertraline, fluoxetine, paroxetine, and escitalopram. Everyone reacts differently to antidepressants, and your mental health provider will determine which kind will work best for your symptoms and medical history. Each one also has the risk of side effects, which is one of the reasons why a strong antidepressant shouldn't be the only treatment option for severe depression. So here's why the strongest antidepressant shouldn't be the only treatment for severe depression. Even though strong antidepressants are a safe option for severe depression, they shouldn't be the only treatment option that you explore. Research shows that medication works best when it's paired with psychotherapy. Therapy is an important treatment because it allows you to work through every facet of your severe depression to learn about the root of your depressing thoughts, emotions, and behaviors. The goal is to help you find healthy coping skills to manage them. Depending on your symptoms, there are some types of therapy that can even be used in place of antidepressants. At Lightfully, we use our process-based therapy as our clinical model. This is a personalized approach to mental health treatment that goes beyond your diagnosis to help treat your entire well-being. It utilizes an integration of evidence-based approaches like acceptance and commitment therapy, or ACT, dialectical behavior therapy, or DBT, and cognitive behavioral therapy, or CBT, to center on 4 core processes that drive mental health symptoms, like those associated with severe depression. Those 4 core processes are emotion dysregulation and avoidance, shame and cognitive fusion, meaninglessness and stagnation, and disconnection and isolation. Lightfully Behavioral Health can help you treat severe depression with therapy. Even though strong antidepressants can help many people manage the symptoms of their severe depression, it's important to know that there are other treatment options that you can couple with them, like our process-based therapy. For some people, it may even be able to take the place of antidepressant medication. Change is possible. Whenever you're ready to get help for your severe depression, reach out to our admissions team. We'll take the next steps together towards the fullest, brightest version of you.